So the next thing I'm going to talk about here is seniors and shelters, okay? And it's so funny, when I was putting this presentation together, it was fun to do because my heart always goes out to the fearful ones and the older ones, you know? So what we'll do today is we're going to talk a little bit about the definition of what a senior pet is. And what are some of the special considerations with being senior? One thing, and I'm really adamant about this, old age is not a disease. Okay? And I always get frustrated with people saying, well, if you're dealing with a medical issue or something like that, well, they're old. Again, and I guess I'm kind of experiencing the whole senior thing here. I just celebrated my 50th birthday about a week and a half ago, and I was thinking, in every young person, or in every old person's young person that's wondering what the hell happened. Because I still think about myself as my 20s, and I think I always think of myself that way. And so I get frustrated with people that look at age as a determination of how we should proceed. Really, you have to look at the disease process. So the first thing is just be aware of that. When I'm doing this, I'm looking at this, old age is not a disease. And I think about myself and how I look at myself, that I don't feel like I'm old. I am now in the mailing list, but I don't feel that way. And I look at my own pets. Like I said, I was sitting there thinking, where am I going to get all these pictures of these senior pets? And I'm surrounded by them. So it's a mindset, I guess. So we'll talk about, what are some of the special considerations for seniors. So even though old age is not a disease, there are some special things we have to be concerned about. And then how do we address those in a shelter setting? And then talk a little bit about the adoption of some of the senior pets. And you guys, some of the things I came up with were so creative. None of this comes from me. These were from other organizations. I just giggled and laughed when I was putting this all together. So I'm hoping you enjoy that part of it. All right. So what's, essentially a senior pet just describes an aging or older pet. What we've got here is my cat Butch, who lived to be more than, both of these animals unfortunately are no longer with us, but Butch lived to be more than 20 years old. And that I know for sure because we got he and his brother. They were the first cats I adopted, Butch and Sundance. They were kittens when we got them, and so I had them they were the first cats I ever adopted. So I got them 20 years ago. And then Cassie, we lived to what we think was about more than 16 years old, because we had her for 14 years old, and for 14 years, and we thought she was probably about 2 when we adopted her, but she was definitely an adult. So I definitely know what it means to have seniors. Okay. And then essentially, the definition of senior really varies. It depends on the species. So cats typically, right, or the actual age is a little bit older when we consider them seniors versus dogs. Also depends on the breed. Like a Great Dane at the age of 6 is probably ancient, right? But with maybe a Labrador might be considered middle age. So, but these are the typical ages. So just be aware, guys. It depends on the organization. There's some organizations, some rescue organizations that consider 5 years or above as being senior. But most people will consider 6 to 7 years for dogs as being senior, or just starting their senior years. For cats, it's anywhere from 7 to 11. I personally, and I'm not the one that determines this, but it's not until, like I said, even my cats are in the 20s, and I'm not considering them senior, but I would say maybe up around 11 or something. And I'd say, oh well, they're just a little bit older, And then the AHA, which stands for the American Association of Animal Hospitals, they actually came out with a study, which I thought was great, on senior care, what they'd recommend to their member hospitals. And how they describe seniors is that they're in the last 25% of their expected age lifespan. So it depends. But I guess what it boils down to, dogs, I'd say probably around 6, cats maybe around 10. But it depends on the organization, how you do it. Okay. All right, so here are the special considerations. But we'll go through each one individually. And what's interesting, again, the same thing that we talked about with we were doing with inappropriate elimination, We'll look at these same things in a shelter environment too. They're all the same. So there's the same things that we look at, whether it's in a practice setting or a home setting or if it's in a shelter environment. We just have to tweak it a little bit. Okay, so some of the physical changes. Now, this is my Cassie. I live on a couple acres out in Oregon, Wisconsin, so just south of Madison, so it was right on our property. And but what happens is that there's a slowing down. It's kind of a general slowing down is the way I would describe it. Their ability to respond to infection is much more prolonged, and the healing process takes longer. Well, this something really hit me is I had like an abrasion on my arm. When I realized I was getting a little bit older, is that how long it took for that to heal. It's like, this is so much longer. So, and that's true with dogs and cats, is that the healing process takes longer. And they have slower metabolisms, and they're producing this hormone, so that means their intolerance of extreme heat and cold is much tighter, meaning that they can't tolerate it as well. So we have to really consider that as well. Okay. And then the big thing here is probably sensory changes. The sight, touch, smell, but it can be subtle too. My dog Roz, who is right here with me right now, right here, she is, so we think she's probably about 14 or so. But the last year, I've definitely seen a difference. I mean, this is she's a border collie, so she's all over the place, Now she's just a little bit slower when she's, responding to things. Her hearing is definitely going, She hates having her picture taken. I can actually go ahead and get my camera. You know how that does that little ding when it first comes on? Before, she would just run up the stairs if I were to do that. Now I can actually turn it on, and she doesn't hear it. So I'm able to take actually more pictures of her now. But definitely it's something that's, I would say, in the last year. And now she's having a little hard time getting up and down the stairs. The sensory things may escape notice at first, but you'll start seeing a difference usually with time. But the most important thing, the message here, the best remedy, is keep them active. So doing things like going on walks, going ahead and doing training with them, keeping them sharp, play. It may be in a little bit different capacity, but all the things it's the same principles that apply. It's keeping them active, keeping them sharp. Now, something to need to consider here too from a physical change is pain assessment. Actually, what AHA is recommending is that pain assessment considered the fourth vital sign. The first three being respiration, heartbeat, temperature. Now it'd be pain. And if you think about that, that's probably really true. Because what we want to do is we want to be able to, once we've assessed that pain, we want to be able to manage it. What's the most common thing we probably see from a pain standpoint, at least from a chronic pain standpoint in older animals? Arthritis. Real common, you guys. And it can be very uncomfortable. Probably more of an issue with larger breed dogs than the smaller ones or even cats, but cats can get arthritic as well. So we need to address that pain to make them feel comfortable, right? And it's so great is that we have, veterinary medicine has come so far. There's so many things that we can address that we couldn't have, even when I graduated from vet school. That, like the Rimadyl is a big thing. That wasn't out there when I first got out of school. And it's because of the advances in veterinary medicine, just like it is with human medicine, and how we're understanding better how we should feed our animals, how we should eat ourselves, that we're living longer. People are living longer and pets are living longer. So these are things we need to think about. But we have to identify the pain, we've got to prevent it if we can, and we have to minimize it, right? So what, as far as prevention could you do? Well, you could think about maybe a softer bed that they could lay on, right? That could prevent them from when they would sleep and then they get up and they're painful. So this is something that's real important, and it's no different in a shelter environment. So here's a long list, you guys. I don't expect you to memorize this, but these are signs of problems. I wanted you to have that list just if you took it back to your organization, you want to say, oh, this is something we should be aware of, that there's a problem. Things like change, a sudden weight loss, or vomiting, diarrhea, or they lose interest in a particular task that they used to love before, like they used to love to play with a ball or something like that. These can all be normal aging signs, or it could be signs of problems too. Because we have to always consider the medical component of this. In many cases, they can be addressed. So the most common problem we see with aging is inappropriate elimination. You guys see, what does Cassie have on her there? A diaper. Okay. As she got in her last year, she got to the point where she just couldn't hold it anymore. And of course, I did all the lab work, and she wasn't in renal failure. She didn't have diabetes. She just was getting to the point that she just couldn't hold it as long as she used to. So, so we ended up, and the diaper worked out just fine actually, and she was fine with it. But that's probably the most common problems, because the idea is that the kidneys of the organs are probably the ones that age the quickest and are affected the most. But there can be disease. So just because they're urinating in the house doesn't mean they're just losing their potty training abilities. There may be something going on. You got to rule out kidney disease. You've got to rule out diabetes. You've got to rule out a urinary tract infection. Because remember, as we age, we're more prone to infection. So still the medical components have to be considered. But that is the most common problem that we see in physical changes. Okay, behavioral changes. You may see some age-related cognitive changes, but they're usually pretty subtle. That's my son with my cat Butch, so a couple years ago. Sorry, I use him all the time, much to his chagrin. But these are the things that we'll typically see from a behavior standpoint. There may be some changes in their orientation. So they go outside and they can't remember why they went out. Or there may be, all of a sudden, and this can be a sign of cognitive dysfunction syndrome in dogs, but they'll get stuck in a corner. Those are severe. Usually they're much more subtle. Like, I'll give you an example, is Roz with her hearing now, is that she was sitting outside, and this happens quite a bit now, and I'll come out and I'll say, hey, girls, come on in, and all of a sudden she'll hear my voice, but she doesn't realize I'm coming over here. She'll go, row, 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 row. Then all of a sudden I say, honey, I'm over here, and then she'll turn around and see me. So that's definitely a change that I've seen, as she's gotten older, is that she's having a harder time orienting herself. There may be less social interaction with other pets and yourself. That can happen too. Sometimes when they're painful, actually, is that they may not even want to be petted because it hurts. So you might find them snapping or something like that. That's why the medical side has to be addressed. They may, groom themselves less. They have some exercise intolerance. They tend to sleep a lot more. So we've got Roz and Cassie here sleeping together. Changes in their eating patterns. Like one of the things, Cassie, she loved to eat. And as she got older, her appetite really was impacted. And that's when I knew things were getting, there was a change. So, but you realize that these behavioral changes may be just behavioral changes of aging, but it can be an indicator that there's something going on medically. So please be aware of that. All right. So just, remember that medical problems, I got ahead of myself here. Medical problems may mask themselves as behavior, problems. Now, as we age, sometimes we have a change in nutritional needs. So pets do as well. So there might be, sometimes you might need to have more canned food, because it's harder you don't have as many teeth. They don't have, or it's harder for them to chew on the hard food as much. But also, you can have prescription medication, prescription food for organ-related problems. Things like there's one for kidney disease, there's one for diabetes, there's one for weight loss, which again is probably the most common problem we see in all animals is obesity. So that can all be taken into consideration here as well. All right, decreased activity. As our pets age, they don't do as much. So it all comes back to, like you were saying too, the best thing we can do, the way we can try to prevent this, is keep them active, just like ourselves, right? Keep them active. My mom is 75 years old, and she's so busy. I'm always like, you know what? I said, it must be hard to be retired. She's had a more active social life than I've ever had in my entire life, and it's really embarrassing. But it's because she's so active. I really believe that she's aged very well, and still lives alone and independently and does great. And the same thing is true with our pets. It's just keeping them active, and exercise is a big part of that. All right. Environment. is in the consistency. So we want to do things is we don't want to move furniture around a lot, right? Especially because their vision might be affected a little bit. We don't want to do any major changes in schedules because that's something that could really, seriously impact them. And just really a consistent routine as much as possible. I realize that there's going to be some days that, if something comes up, but as much as possible, try to keep a regular routine. It's probably more important with our senior pets. All right. So now we're talking about the shelter environment. Everything's the same, right? The only difference is before I described it as physical changes. Well, now we have to be looking at physical health, right? How are we going to deal with that? Behavioral changes. Now we're looking at health. So that's, we know when we get seniors that are surrendered to us or they're strays or things like that, then there's going to be specific things we have to consider. But remember, old age is not a disease. Right. Oh, I wanted to bring this up. A real good source of information is there's a survey of finalists for the Maddie's Fund and Pet Finder marketing competition on senior pets. And as a matter of fact, it was in the Maddie's Fund newspaper. Oh, okay. Because I saw just the article itself. I didn't know it was actually in the newsletter yet. So that just came out in September. And it was very well written, I thought, for one thing, and did a great job of summarizing the results of the survey. But that'd be a good source to go back to. So the first thing is physical health. What do we have to do? We have to do physical exams, right? There should be a consistent theme here, guys, is the need for physical exams. That's how because we have patients, they can't tell us what's wrong. So that's why our physical exams are so, so important. Having caregivers, volunteers, and staff reporting problems. That's another thing, too. Like, we can't tell by doing a physical exam if a cat has diarrhea, right? We would need to have, unless, of course, they have staining in their anus area or something like that, but we would need to have our staff or volunteers let us know about it. So reporting is important. Doing laboratory work. Now, treat medical conditions as needed. As Dr. Manfred pointed out earlier this morning, and I thought this was great, dental problems. That's the most common problem that we see. And, I love that shelters and rescue organizations are thinking about addressing this now. Because we could really put ourselves in a better position to adopt these animals out. Now, usually senior animals, not always, but senior animals that have the dental issues. We'd be in a much better position for that. And then we have to, adjust any kind of exercise according to medical conditions. So if you've got an arthritic animal, it doesn't mean they can't go for walks, but maybe they're going for more limited walks. So, and that's where your medical team should be in a position to make recommendations on what type of activities and exercise that they should be involved with. Monitor, for emotional well-being. Well, just like with all animals, of course, foster care is probably the best, right? If at all possible. That's true for the older cats too. But what many shelters will find is that the older ones will find a home in somebody's office. That's at the shelter. This is, again, my cat Butch, who he loved to hang out with me in my office. And this is usually where he put his head, of course, when I was trying to get some work done, of course. But in a shelter environment, when you can't do foster, probably the two most important things to remember is to provide them with a quiet area, in most cases, where there aren't a lot of activities going on. And then if there's a play area, something like that, to separate the dogs. And it's true cats, too, if they have a play area, from the younger ones, where there's a lot more activity. So I kind of remember those two things. And providing individualized attention. As our nutritional needs change as we grow older, oftentimes you'll find more canned food and prescription food if needed. And then as far as exercise and play, well, with cats or with dogs, what we do is usually gentle walking. And maybe not for as long. Maybe you spend more time sitting on the park bench and giving them attention as opposed to actually walking. It depends on the individual. So that's the key here. And like I talked about before, in the play area, keep senior pets separated from the real young ones. Because the other part, too, is maybe another dog, a puppy comes up, and they just want to play, but maybe they jump on an older dog, and they're real arthritic. They could actually injure them. With cats, What we're talking about more is socialization and playtimes. Again, this is my son. We were at the Dane County Friends of Ferals in the well room doing some socialization of cats that we were trying to find indoor homes for. But the important thing there is to have socialization and playtimes with cats. And then as far as the environment is concerned, like I talked about, quiet area, foster care if possible, housing in a quiet area, providing softer bedding, I think is an important thing to do for dogs and cats. And make sure those litter boxes are easy to get in and out. That's definitely something to consider an older animal because it's harder for them to do that. And maintain a regular schedule as much as possible. All right. So this is the part that I loved was when I was working on this section of it, is talking about the adoption of these guys. And so we'll talk about some of the concerns of potential adopters. We'll also talk about the types of people that are typically drawn to senior animals. How do we sell our seniors? And then we'll talk about some creative ideas. Again, I'm always amazed. I wish I had this kind of creativity, but I'm amazed at some of the ideas that they came up with. Okay, but again, another good source for this information, because a great breakdown, is the survey of this of the marketing competition, and what what their feedback was. Okay. So the concerns of potential adopters usually has to do with potential health problems. This is probably not real surprising, right, guys? Do you experience the same thing? They're worried about them getting sick or dying too soon, right? So I think that's reasonable. I mean, I have this. I have to admit, I would think it would cross my mind. Adopting. Usually, I don't adopt animals; they just find me, or I foster them and I become a foster failure. So it's usually one or the other. But anyways, but the key here, to deal with this, is really address their health care concerns to let them know we've done everything we can to make sure that this dog or this cat is in a good condition. They've had real extensive veterinary care. We've done lab work. That rules out hyperthyroidism, rules out kidney disease. There's lots that we have at the laboratory I work with. It's called a Life Stage 3, which is like a geriatric profile, where you can look at lots of different things. So you could try to alleviate those concerns that potential adopters have by reassuring them about the medical care that the dog or cat has received and the lab work that's been done to try to determine there aren't any issues. I mean, obviously you can't do everything, but you can do physical exam, lab work at a minimum. We're going to be doing that anyways, right? The physical exam. Part of it anyways. All right, so this is my mom. And these are two dogs that are no longer with us, but they were both older when she adopted them. Now, the neat thing about seniors is that they usually, now look at over here, Nellie here is 98 pounds. Okay? Now, usually I wouldn't recommend a 98-pound dog be adopted by someone in their 70s. But Nellie, first of all, needed a home. Okay, she was at the Dane County Humane Society. But secondly, she was really mellow. So essentially, their energy levels were very matched for each other. She could still go on walks with my mom. That's what my mom likes to do, is go on walks and things like that. But so the energy level makes a difference, too. Another group of people that's attracted to adopting seniors are child-free homes, because there's usually not quite as much activity and stuff like that going on. And so they're attracted to the seniors' less demanding nature. Okay. And then the perception of the people that responded to the survey done by Maddie's fund was that they're big-hearted and compassionate. And I know it's subjective, but I would have to agree. It's typically the people who adopt the seniors, there's just a real special place in their heart. So how do we sell our seniors? All right. Being creative is one of them, but I think going ahead and concentrating on the fact that they're usually calmer, more established in their routine and things like that, that's something to think about. But that they're more easygoing is something to concentrate on. Big one here too is what you see is what you get. Oftentimes when people are considering like adopting a kitten or a puppy, I said, you know what? The idea of getting an older, an adult animal, and I don't say older necessarily, but I say an adult, is you usually get, what you see is what you get, meaning that you already know their personality. You already know if they have, not to say issues couldn't develop, but you know if they get along okay. Like in my household, it's important that dogs and cats get along. So I really would want an adult animal so I can know that, because I can't get rid of one animal because they don't get along with the other species, So, so what you see is what you get. Also, is that they're less work. There's just no doubt about that. Who's had a puppy recently? A lot. Well, you're probably fostering them, right? But they're a lot of work, And with the older pets or the adult animals, it's not as much of an issue. They're you kind of can get the feel-good factor. Dr. Peek shared that with me before. I never heard of that before, but the feel-good factor, when you do something just because it feels good. And adopting an animal that may not have been adopted otherwise, sometimes it can be very, very helpful. And it kind of matches the perception that senior pet adopters are motivated by compassion anyways. So it kind of fits in with that. And the thing we recommend is avoid using the word old, or geriatric, I think is another one too. But do things like senior, I think is a good one, or mature, and I thought this was really good. Wisest residents. That's a creative way of referring to them. But there's a senior dog project where they got all the website information here where they talk about the top 10 reasons to adopt an older dog. So that'd be kind of like, I think it's modeled after David Letterman when he does his top 10 lists. So it's the same type of thing. So let's go forward here. So I'm going to be talking about the creative adoption ideas, different campaigns, telling individual stories. But we'll be going through each one of these individually. But before I do that, there are two that I'm not going to cover specifically. What some organizations will do is they'll actually reduce or waive the adoption fee as a way of promoting people to adopt seniors. Okay. And some organizations will actually have fundraising programs to cover medical expenses for, after adoption. So there's a couple different things to do. All right. Probably a real popular one are campaigns to adopt these senior pets to senior people. And they'll actually bring adoption events to senior living facilities. The idea here is by going out to the seniors and taking the animals to them, there've actually been a lot of success in adopting having the seniors adopt the senior pets. And they usually have more time to spend with them too. But there's been lots of really successful programs in doing that. A lot of people are motivated by the individual story. This is my mom's dog. Her name is Katrina. And the reason that she's called Katrina is that she was such a disaster when the rescue organization took her in. She had Demodex, she had generalized alopecia or hair loss, she was hyperthyroid, she had otitis externa, ear infection, she had all these terrible things, okay? And my mom had lost a pet, lost her dog, because she still had cats. She had lost her dog probably 9 or 10, her last one, Brandy, who was on the screen previously, about 9 or 10 months previously. And she was saying, I don't want a dog, too much work. Now, she's had dogs literally all of her life. And I couldn't believe my mother was like, this is going to be the first time she's ever without a dog. I can't believe this, And so it lasted about 9 or 10 months. And then there's someone who I work with, Dr. Cece Sheldon, who's at the Madison Area Technical College. And she would always bring, because they were dipping her for the Demodex. And every time I would be there for these spay-neurothons where we would have once a month, she'd show up, Katrina, goes, so how's your mom doing? And so I ended up telling my mom about this dog, of course, and she adopted her, and it was the perfect match. It really, really was, because Katrina needed someone special, my mom needed another dog, and so it worked out really well. So many times people are motivated by the story. So tell the story. Tell it. What's that? Work it. That's right, I like that. Work it. Because the story is something that really, really motivates potential guardians. It motivates me too. So I think there's a lot of organizations that don't take advantage of this enough. And it doesn't have to be something extensive. It could be just a blurb, but just tell their story. Okay. Now, this isn't just for seniors, but just the example I have here is for seniors, is that you could do a celebrity lookalike. All right, this is Eddie Munster. Does everyone remember Eddie Munster from the Munsters, or are we too young of a crowd here? Okay. This dog, guess what his name is? Eddie, named after Eddie Munster, because they look awful lot alike. Well, this was definitely, because this is so cute and funny, and there really is definitely a similarity. Well, that's what caught my sister's attention. Guess who adopted Eddie? And Eddie really he had to have like a full mouth extraction. He did have to have a lot of medical work after his adoption, just because the rescue organization couldn't afford it. But she was willing to do it. And she'll laugh at me when I say that. But so she adopted Eddie, and he's like the greatest dog. She goes, yeah, ever since I've adopted him, now everybody else wants to adopt him. Because he's so personable and all of that. And it was this one thing that, it was an email that she got that had this comparison of the two, that's what caught her eye. Now there's some special programs at the Berkeley East Bay Humane Society. They have a program that's called the Golden Paw Programs, and there's the websites and everything. But what they really stress there, because they know that potential adopters of seniors are very concerned about the health aspects of their senior pets. They really stress how all the animals that are there, that are up for adoption, that are senior, have received veterinary care, that they've had some screening done, with the lab profiles and stuff like that. And then, of course, they talk about all the benefits to having seniors. They're more relaxed. You know what you're getting, all the things that we talked about already. But they're a program that's known pretty well. And there's another one at the Oakland SPCA that's called the Whiskers and Muzzle Club, or the Silver Whiskers and Muzzle Club. And they have, kind of the same thing, all a different approach. But the one that I liked the most was the Animal Friends Red Collar Society. Is everybody familiar with the Red Hat Society? Okay. So these are mature women, and I can now be in the club, which scares the heck out of me. But what they do is they celebrate aging by just having a good time and having fun, enjoying life. Well, what this group did is they actually took that same idea and applied it to senior pets. So now they have the Red Collar Society, so they actually have a collar. And so what they've done is they've taken something that was, everybody, and most everybody knows what the Red Hat Society is, and applied it to the dogs, and I thought it was very creative. As a matter of fact, these guys were the winners, or one of the finalists, right, for the Maddie's Pet Finder marketing competition. And I just thought it was so cool that they were creative. Because I have to tell you, once I heard that, it drew my eye. I wanted to go learn more about them. So I went immediately when I read about it, I went to their website and all of that. So it's just a matter of being, being creative. Okay, so we've got about 5 minutes here for questions.